Hi, my name is Mary Hollowell. I'm a speech-language pathologist at Siskin Center for Developmental Pediatrics at Siskin Children's Institute. And you may be wondering what speech therapy looks like, what kinds of techniques are used, and what to expect if you have a child who is in need of speech therapy. So we're going to talk a little bit today about what that looks like here at Siskin. Speech therapy is a type of therapy that helps children who have any type of difficulty with communication. So that could include difficulty making their needs and wants known. It could include difficulty with producing speech sounds so that others are able to understand them. It could include their ability to understand what they hear, so following directions, answering questions. It could include putting sentences together appropriately, using grammar correctly, or even social communication, so having conversations, making friends. So any child who has a difficulty in any of those areas can be helped by speech therapy. If a parent has any concern that their child might be delayed in speech and language skills, so say that they're not using any words at 18 months of age, or maybe they're not putting any words together when they're 2.5, like they notice that their peers are doing, then that is a great time to request a referral for speech therapy. We also work a lot with children who are on the autism spectrum, or children who have some type of genetic disorder such as Down syndrome. Those types of children typically will need speech therapy, so we see a lot of that as well. So when they come for their very initial appointment, that's going to be an evaluation, and typically those appointments last between 90 minutes to 2 hours, just depending on the child. And we will bring the family back. We will do a clinical interview, so just getting the parents' concerns, getting any relevant medical history, see how long the problem has been going on. Then we'll do some clinical observation of the child, so seeing how they are communicating, how they're interacting, how they're playing. And then we'll do some sort of standardized evaluation with the child so that we can compare their communication skills to other children their age. And that might look a little different depending on the age of the child. It could be a play-based assessment where we're interacting with toys, or it may be a more structured assessment where we're having them look at pictures, answer questions, follow directions, things like that. One of the huge benefits that we have here at Siskin is that we have so many disciplines under one roof. So a huge benefit that we have is that we're able to collaborate and work really closely with other disciplines. So for instance, we frequently co-treat with occupational or speech therapy so that both disciplines are able to see what the other discipline is working on and try to incorporate those goals together. So that is one great thing that we have here at Siskin. Another thing that makes the speech therapy program specifically different is that we have therapists here that are very well versed in augmentative and alternative communication. So that is for children who maybe have limited verbal speech or have difficulty with verbal speech and are using some augmentative form of communicating, whether it be a high-tech device like a speech tablet or a lower-tech system like pictures. We have a lot of experience here with that, which is less commonly seen. We really like to have most of our sessions be very child-centered and play-based, meaning that we use play and the child's interests to work on their speech and language goals. So that might be something like having a child in a swing and pushing them on the swing and then stopping the swing so that they have an opportunity to say go or more or swing. Or it may include having a child practice their speech sounds a certain number of times and then getting to take a turn at a favorite game. It really just depends on what the individual goals of the child are. And we also try to keep the parents as involved in the sessions as possible. If not physically in the sessions with us, then we like to have them in the observation room, and we're always talking to them after the session about what we worked on, what strategies were successful in helping their child be a better communicator. Any strategies that we're using in the session, we make sure that the parent is aware of how they can implement them at home. And if it's appropriate, sometimes we give actual physical homework, like if maybe the child is working on a specific grammatical structure or on speech sounds, then we might give them like a physical paper that they can take home, something that they could practice at home. Or it may just be, hey, what's your child's favorite activity to do at home? Here's some ways that you could embed their speech goals into that activity to help engage them and keep them moving forward. If a parent has concerns about their child's speech and language skills, then they can request a referral from their primary care provider, and that will be the first step to getting an evaluation scheduled here at Siskin. For more information about speech therapy at Siskin Children's Institute, visit siskin.org/speech.